So prodrugs are not the new concept for you people, as you have already may have heard during in the previous semester or years. So what are the prodrugs? Prodrugs themselves, they are inactive molecules. So these inactive molecules are not showing any kind of activity. However, once they will enter into the body, they will be metabolized, and these metabolic reactions can be several types. Let us say oxidation, reduction, hydrolysis, or it can be some kind of acetylation or whatever. Right. So by this kind of mechanism, they or somehow other metabolism, they become active. And once they become active, then they possess therapeutic action, the pharmacological action. Now, this is much required when we wish to pass, or when we wish to surpass somehow kind of metabolism, such as first pass metabolism. We wish to surpass this enterohepatic circulations, or if we wish to increase the stability of the molecule, if we wish to increase the permeability, if we wish to reduce the toxicity of the molecule. See, all of these circumstances, these prodrugs are useful approach for us to determine the selectivity of the molecule. So that is the main objective behind this, and generally we wish to we are using prodrugs. But since you might have learned previously, but this presentation, this discussion is going to discuss majorly what are the several components of prodrugs, what are the ways to increase the permeability and other ways so that we can increase the therapeutic actions. So what are the modes which are generally carried out in the recent scenario, right? So we will be covering not only the drugs which are being marketed, but also what are the further advancements on this that we are going to touch upon in this session. Okay, so let's start our discussion from this, and from the discussion on this very first slide I am bringing this one. Right, this is actually one of the I wish to introduce the prodrugs more clearly, and this is related to prodrug, and it is a part of certain movie. Right, so this is a movie which is based upon this our PM Narendra Bhai Modi. So although I'm not promoting the BJP government or something others, but if you refer to this movie, then in this movie there is a particular scene which I would like to focus for your knowledge. So in this movie there was certain scenes were there. So what they used to do, that the prime minister of his time, that was Indira Gandhi. So Indira Gandhi has ordered that wherever Narendra Modi is there, so he should be caught and should be put behind the bar, because he want to do certain agitations against certain movement or certain decision taken by the government of his time or that time. So the police were running behind him, and wherever if he is that, he will be arrested and will be put in the jail. So there somehow police surrounded this place of where Narendra Modi and his team and other teammates were there. So they to bypass from this police trap, what they have done, they tried to mimic or create some kind of funeral of one of them. So જેવી રીતે કહીએ ને કે શમશાન યાત્રા, તો કોઈ એક માણસ મરી જાયેલું અને એ પછી શમશાનની પેલી ઉપર પડેલું હોય, અને then other people just say રામ ભાઈ બોલો ભાઈ રામ. So Ram Nam Satya. So that way they tried to mimic the funeral. They tried to create that drama, although nobody was killed or nobody died. And thus, generally police did not inspect such kind of funerals, because people have died, and if they inspect the funeral, then there will be the emotions of the people or the relatives may be hurt. So that's why these people wearing the white clothes and covering their mouths with the help of some whatever the clothes, and they could they could escape this trap of the police, and they could flee away from the place surrounded by the police. So this is the scene which is shown in this movie. So that I wish to correlate with the our approach behind using the prodrug. तो जैसे शमशान यात्रा का बिहेवियर, उसका ड्रामा प्ले करने के बाद नरेंद्र मोदी could accept from the police, and similarly prodrugs are also like this. Themselves they are inactive, but they try to mimic that they are inactive, but although they after the metabolism they will become active, right? And it will help to escape the metabolic pathways, first pass metabolism, enterohepatic circulations, or whatever that we can reduce the side effect, increase the therapeutic action, increase the pharmacological action. So that is the main objective behind this. So what are the prodrugs? Prodrugs are the compounds which are themselves inactive, but once they become once they will enter into the body, and they will be after conversion they will become much active one. Metabolic enzymes which converts the prodrug to the active drug. So we know that our body is composed of so many enzymes, transporters, ion channels, and many other things, right? So basically these drugs will be metabolized by this enzyme. Enzymes are really those made up of proteins, and they are having this kind of activity. There are number of enzymes are present into our body, and this International Union of Biochemistry has given a different classification for enzymes such as lyase, peptidase, isomerase. So if you refer bioorganic chemistry, biochemistry by Satyanarayan, you will see the classification of all these enzymes, right? Phosphatidase or kinase, and there are so many classes of the enzymes which have been classified according to their mode of action or kind of this way. So the sound knowledge of metabolism that helps especially medicinal chemists to design the prodrugs, right? Not only medicinal chemists, but also it will help the pharmacologists when they will be studying the effect of certain drugs in vivo systems on, let us say, rats, mice, or monkey, or hamster, whatever. So at that time also, when one is involved in the study of pharmacokinetic and pharmacodynamic parameters, so at that time it can give some idea to the people regarding this one. So prodrugs are then activated by the enzymes, and mostly however several types of the enzymes are there. Some of them are listed on your slide, such as esterase, phosphatase, amidase, N-methylase, or demethylase, or decarboxylase. So these are the enzymes which are involved in the activation of so many kinds of the prodrugs, right? So each and every enzyme has certain concept. For example, this esterase enzyme is there, which is involved in hydrolysis of ester. So ester hydrolysis will produce the carboxylic acid and alcohol. So that is this one. Phosphatase enzyme. So as the name suggests, phosphatase, it is responsible for hydrolysis of phosphate bond. It will produce phosphoric acid and again hydroxyl group containing species. Amidase enzyme. So as the name suggests, amidase, it is involved in breakdown of amide bond, and hydrolysis of amide bond can produce carboxylic acid and amine. So that is amidase enzyme. That is for amide bond. And demethylase, removal of methyl group, demethylation purpose, and especially the removal of methyl group which is attached to nitrogen. Decarboxylation. So majorly this time this enzyme is decarboxylase, and that is involved in removal of this carboxylic acid group. Okay, so these are the several enzymes which are involved in this kind of activation of particular prodrugs. And prodrugs may be especially, we know that functional groups are the reactive molecules, and they generally, our purpose is to mask the reactivity of the functional groups sometimes, or the functional group which are responsible for causing side effects. So what we can do, we can reduce their side effect by somehow reduction of or masking that particular functional group. So this way prodrugs are much useful when it's there. This is exceptional case that not always the prodrugs are activated by the metabolic enzymes. They may be activated with the help of light source. Right? We know that whatever the light which is coming from the sun, that is composed of so many radiations. Right? Before that, although it may be a visible light having a radiation of 400 to 800 nanometer, but also there is something called UV visible light, IR radiations, and many other radiations are there. Okay, so these radiations also act as a to make the molecule much active. And one of the example is there on your title screen, which indicates the use of this radiation therapy for in cancer, especially for a localized cancer such as whether it is skin cancer or something there. So that is used in cancer therapy for localized disease condition. A drug with photolabile substances, so that is also there, where basically after release of a particular substance, it will produce this drug and photolabile substance. So you can see that in this schematic representation, this is basically yellow colored sphere, which is nothing but a drug, and that is connected with a particular photolabile substance. So right now it is inactive, but once we will have light exposure of light over here, then this will become active, and that will make the active drug and a photolabile substance. Since it is photolabile, so in the presence of light it will undergo degradation, but in this is our drug which will be easily able to show its therapeutic action against the particular disease. Okay, so friends, this is one of the approach we wish to discuss for several other prodrugs, right? And the advantage is that whatever the photolabile substance we are using, that must be non-toxic in nature. Non-toxic, it should be safe, and it should be easily excretable, or it should not cause any kind of side effects. So that is the main advantage for using this kind of prodrug approach. So there are several strategies have been employed for increasing the therapeutic action of the drug. Whether it is, say, increasing the membrane permeability, reducing the side effects, increasing the therapeutic action, or increasing the water solubility, or many other these approaches are there. So whatever the problem is there, and think for that can be, is it possible to develop a prodrug for particular to overcome the synthetic therapeutic action? And yes, this can be useful for several other approaches. So here our purpose is, this is one of the strategy where prodrugs have been employed for increasing the membrane permeability. Now, why membrane permeability is required? There are certain diseases where membrane permeability is a key factor to control the therapeutic action of a particular drug. Now, let me give you certain example. You know tuberculosis, that Mycobacterium tuberculosis are the pathogenic, deadly pathogen which is responsible for tuberculosis, TB. And if you wish to kill these microorganisms, mycobacteria, then one has to target the several other targets across this cell wall of mycobacteria. Human people, just like we, the eukaryotes, do not have cell wall. But mycobacteria, they are a kind of mixture. They are in between their cell. Their structure is in between the mycos, fungus, and the bacteria. That's why their cell wall that is composed of mycolic acid. So that's our objective is, and mycolic acid is that is totally different from peptidoglycan, which is observed or in case of gram positive bacteria and absent in case of gram negative bacteria. So mycolic acid has a different structure, and that is really complex in nature. So if we wish to target this deadly pathogen, then we should have a certain molecule which at least can cross their this cell wall. And to cross the cell wall, membrane permeability is a key factor to which we should control. Okay, so I'm going to show this several the prodrug approach for this, and the first and foremost prodrug approach for several this molecule, that is ester. We know that ester is no more than the combination of carboxylic acid and alcohol. So we can make this ester molecule, and this way, look at this one. Carboxylic acid is more polar in nature, less hydrophobic, although moment it can undergo ionization to carboxylate and proton H plus ion upon dissociation, right? So if we have alcohol, then it can make carboxylic acid and this primary alcohol, and so we will have this ester. Now this ester, which is less polar in nature and however more hydrophobic. Now why it is more hydrophobic? Because of the extra presence of this R dash from this alcohol. So that is less polar, because the hydrogen bond making carboxylic acid is no more than hydrogen bond making hydroxyl group is no more here in the form of ester. So that's why it is less polar. It is more hydrophobic because of the hydrophobic presence of these alkyl groups, whether it is R or it is R dash. Now this more hydrophobic, in other words, it is more hydrophobic. So in other words, it is more lipophilic. So that is easily soluble in lipid, and lipid is no more than this mycobacterial cell wall, in other words. So now it can cross this cell wall much easily, and there will be certain other enzymes over there, so they will, such as esterase, and so esterase means degradation of ester bond, and it will release the carboxylic acid, release the alcohol. So thus this ester prodrugs, which we used to call as for the temporary masking of awkward functional group, that is one of the important way to target binding and crossing the cell wall membrane. Okay, for example, carboxylic acid. We can easily transport carboxylic acid by making its ester prodrug. And this way, for increasing the membrane permeability, esters are one of the better solution for this purpose. Enalapril. This is another drug, basically a kind of ACE2 inhibitor, angiotensin converting enzyme 2 inhibitor, and most of these ACE2 inhibitors are used in hypertension, and captopril, enalapril, and there are so many classes of these drugs. The side effect is that they generally cause ACE2 enzyme inhibition and a kind of particular pertussin a kind of kinase inhibitor. So that's why they also cause the dry cough. So dry cough is their side effect. So these ACE2 inhibitors, which are basically a prodrug for antihypertensive as an antihypertensive agent used in hypertension. So this enalaprillate is an active molecule. If we have this structure, which is no more than the structure of proline, which is an amino acid, carboxylic acid is there. So if we have R group over here, so and if R is hydrogen, then it will be enalaprillate, and if R is ethyl, so in other words, it will be, let us say, ethyl ester. So that way it shall be in enalaprillate, which is a kind of prodrug for antihypertensive agent. Okay, so this way enalapril is a kind of prodrug for enalaprillate is an active molecule, and enalapril is a prodrug. Okay, so this is also another approach, that by making ester molecule, it will be easy for a drug to cross the cell walls, or we can increase the permeability across the cell membrane, cellular membranes, right? So not only ester, once we know that there is a probability of this alcohol, then we can construct the groups which especially ester groups which are more susceptible for hydrolysis. And the chemistry people knows that this we can increase this we can increase this powerful hydrolytic action with the help of, let us say, this alcohol. And for that we will require this let us say somehow this fluorine which is attached with this carbon or this methyl group, so that way it will snatch the electrons from oxygen and this bond will be more weaker in nature. So not only CF3, but we can have, so this is so CF3 is given, but not only this CF3, but one can also put this carboxylic ester, carboxamide or phenoxy, etc., to create the kind of that action which is, and which can show, let us say, this hydrophobicity kind of this thing. Sorry, not hydrophobicity, but a kind of hydrolytic mechanism there. So by use of electron withdrawing groups, we can weaken the ester bond, and thus once we weaken the ester bond, then it is easy for the molecule to undergo breakdown. And once the ester bond will undergo breakdown, it will form carboxylic acid, it will form, let us say, this water molecule, and this way it much easily we can have it in this ester bond. Okay, we increase the membrane permeability. So not only ester, but along with the combination of alcohol, we can have carboxamide, we can have phenoxy ether, aryl ether, or we can have this alkyl trifluoroalkyl ether to make this design part of particular products. Another approach is that this improve the membrane permeability. One can use N-methylation. So common metabolic reaction to reduce the polarity of amine can be used for this purpose. Hexobarbital, which is sedative, a kind of hypnotic, a kind of anxiolytic drug, and it is inactive. So hexobarbital, the structure is there on your screen, and that is inactive in nature. But look at this one, once it will undergo this demethylation in the presence of N-demethylase enzyme, then it will be active in nature. So this way we can increase the prodrugs for membrane permeability with the help of N-demethylation. And इस N-demethylation का काम तो एंजाइम का है, but as a people, we people have to as a medicinal chemist, as a pharmacologist, one has to perform N-methylation of the active molecule of hexobarbital, and that can be achieved only with the help of N-methylation. Right, so chemistry aspects is there which can make the with the help of, let us say, methyl iodide, methyl chloride, we can perform this methylation of this active molecule and construct this prodrug, and prodrug can be easily given to perform the hypnotic. Now why it is there? Because if we want to produce the hypnosis, then definitely drug will have to cross the blood-brain barrier and will have to reach to a particular center in the brain to activate the action for sleep, to activate the action for hypnosis. So to increase this BBB permeability and or to cross the cellular membrane permeability, one can design this kind of drug. And this is, remember, this time it is not the esterase, this time it is simple N-methylation. So just by addition of methyl group to the nitrogen of this, one can be much easily introduce this kind of action. Okay, this is not much I should not explain to the people who are expert in learning the aspects, Parkinsonism is a disorder which may occur because of this deficiency of the enzyme called as deficiency of neurotransmitter called dopamine in central nervous system. Parkinsonism that will occur because of the deficiency of dopamine in substantia nigra, a part of the brain which is there, and basically it fails to produce the level of maintain the level of dopamine in this uh, part. And majorly it is observed in the case of the people who are having this at a longer age, this will develop, right? So that's why the transport of majorly this transport of the amino acids and these things are really problematic is there. So for transport proteins also one can use this. And the major deficiency behind is that dopamine, basically that is a neurotransmitter of central nervous system. But however, it is not present in peripheral nervous system because there is one enzyme called dopa decarboxylase, where if we try to give this dopa, which is amino acid no more than dihydroxyphenylalanine, right? So because of this phenylalanine, this is a structure of phenylalanine, and 2 hydroxyl group is there. That's why it is levodopa, because this is you can also call it as L-levodopa, okay, as it is L amino acid according to Fischer projection. Okay, and levodihydroxyphenylalanine, this enzyme cannot cross levodopa can cross blood-brain barrier, but this dopamine cannot cross BBB. Now, why dopa can cross the blood-brain barrier? Because of the presence of this hydroxyl group, and it has optimum polarity so that it can easily cross this levodopa. Levodopa can easily cross blood-brain barrier. But once it will cross the blood-brain barrier, and then it will undergo into the central nervous system, the brain, the spinal cord. And here there is an enzyme called dopa decarboxylase. This dopa decarboxylase will metabolize this dihydroxyphenylalanine to dopamine. And thus we will be able to maintain the level of dopamine, the beta-arylamine in central nervous system. So friends, this way we can utilize levodopa, a kind of prodrug which can be used in Parkinsonism for this purpose, right? So that way these prodrugs are the kind of basically a drug molecule which can be this way it can be used to increase the membrane permeability, and that is somehow kind of Trojan horse approach, where generally we the dopamine is there, but there are certain enzymes such as dopa in the presence of just Jo enzyme, these enzymes, some of the enzymes are involved in metabolism of acetylcholine, adrenaline, sorry, not acetylcholine, but adrenaline and noradrenaline. The same enzymes can also metabolize dopamine. So that is the limit in peripheral nervous system. So directly we cannot give dopamine because it will be metabolized by this peripheral enzyme present in peripheral nervous system. But if we give dopa, it will not be metabolized because of less tendency to undergo metabolism, and dopa decarboxylase in CNS can metabolize into dopamine, and dopamine ultimately required in the patient of Parkinsonism who will develop the disorder, right? And Parkinsonism patients, they will have a kind of different walk, a different kind of tremors in the hands, and they will lose the control on their voluntary movements. So these are the major symptoms which are observed in Parkinsonism. If you refer Rangendel, Pharmacology by Rangendel, it is very nicely explained in this book that what are the symptoms of Parkinsonism and the classification of this drug, Parkinsonism or the drugs which are used in Parkinsonism, the classification also you will find much interesting in this book. Fine. So these are the basically approach for increasing the drug permeability. Now we are going to learn the future or the other aspects for increasing the activity. Activity is nothing but this is simply called as therapeutic action of a drug, the pharmacological action of a drug. So this can be also used in using this prodrug approach. Let me jump very quickly to the first approach, and the first approach is 6-mercaptopurine. 6-mercaptopurine is one of the enzymes which is generally involved in body's immune response, and that is used in donor grafting. Right? So science has advanced so much level that people can involve in so many organ transplantation or something called this donor or some organ transplantation, or also called, let us say, some surgical conditions as well. So that way 6-mercaptopurine is used. But 6-mercaptopurine has a limitation that it will undergo quicker metabolism. So one has to make another prodrug of 6-mercaptopurine to increase its stability. So we can increase the stability with the help of usage of azathioprine. Azathioprine is this prodrug, and 6-mercaptopurine basically it is a active molecule. So you can see that once it is given to the patient in the body, there are certain glutathione which are involved in phase 2 metabolism, and thus they will be making they will be making this 6-mercaptopurine, and which will be through the attack of this 6 glutathione. You can see on the reaction mechanism that glutathiolate will attack on this carbon, then this will go back, and nitrogen will have negative charge on its head. So when it will be back, so that will remove this 6-mercaptopurine. So now we have 6-mercaptopurine which is connected with this methylated nitroimidazole. So if you could not understand this pathway, so simply what you can do, take out a piece of paper and a pencil and or note pen and try to draw this mechanism, so that you will be able to understand that the shifting of the electron, and then it will be back, then what are the further changes observed in the products, that you will be easily able to remember. So nitro is a prodrug which is here take part as an electron withdrawing group, and ultimately that is involved in this process to support duration of action. Simply, with the help of this prodrug approach, we can increase the therapeutic action of a drug. Previously, 6-mercaptopurine was given, though with a very slow time, drug concentration will be enhanced, but after a certain period of time, it will be reduced to the plateau phase, or you can call it as a zero phase will be achieved. Okay, so to avoid this, generally what we can do, we can make a azathioprine. We can make the azathioprine, which is basically a prodrug for this one, and it can increase the therapeutic action of this molecule 6-mercaptopurine. And now we will have static action behind this, and it will be totally slowly will be increasing with the passage of time. Drug concentration will also increase, and thus one can have better therapeutic action. Okay, so let us go to the another approach after azathioprine, that is diazepam, and diazepam are no more than you can call them as, let us say, benzodiazepines, and especially benzo 1,4-diazepines, which are considered as a privileged scaffolds in medicinal chemistry, in organic chemistry, because of their anxiolytic, therapeutic, and hypnotic action. Diazepam. So diazepam, the trademark which is of this drug, is being marketed by the names of Valium and Librium, and they will become active after the metabolism via and demethylation and to nordazepam. So nordazepam, that is basically active molecule. Diazepam is a prodrug, and that is simply where we can increase this metabolic activity. Okay, yeah. Then saproguanil, cycloguanil are another kind of approach, also associating a particular lipophilic group will may also increase the therapeutic action of a particular drug. Cycloguanil is basically active molecule, and proguanil is its prodrug. So these are used in malaria, and they are involved in enzyme inhibition of this enzyme called dihydrofolate reductase. Our objective here is to make a prodrug of cycloguanil palmoate. So we are making its palmoate salt. So this salt will be easily stored in the fatty tissue, and that will be very much slowly released, and steady release will show the therapeutic action. Okay, this therapeutic action will be ultimately may show the biological action, and finally one can have a slow and steady release in case of this one. This is another approach where prodrugs can be used for the purpose of, let us say, this activity. Okay, and this time fluphenazine has been shown over here, and this is an injection which is given by intramuscular way, and that slowly will diffuse from fatty tissue to the blood supply because of the presence of this, and now it can undergo rapid hydrolysis of this to release this fluphenazine. And what are the use of fluphenazine? You people much better know than me that fluphenazine is basically used for the purpose of this antidepressant, or somehow kind of this anti CNS depressants. Sorry, it is used for especially as an antidepressant in the patients who are having the symptomatic depression symptoms. So those reasons fluphenazine is basically given. Right, and this prodrug is given by intramuscular injection because it will easily transport from the fatty tissue, from the lipoidal tissues to the blood, and slow and steady release of this drug will make the slow and continuous release into the blood, and thus we can achieve the antidepressant action in the molecule. And after this, this is salicylic acid. So you people very well know that salicylic acid are kind of nothing but O-acetyl salicylic acid, and which is generally salicylic acid is much toxic. It is said that salicylic acid is obtained from the bark of the tree named as willow bark tree. So if I have read some book, I forgot the name of the book, but when I was a student like you, so I have one of our teacher has also given the name of this tree, which is called willow bark tree, and from its bark, a potential source of salicylic acid. That is a huge source of salicylic acid, and we can use this obtain salicylic acid directly by extraction of this. Okay. Also, salicylic acid can be synthesized from somehow called a Dow process, which is used to make the phenol, and then carboxylation of phenol. So that can be useful for making through the Kolbe-Smith process. Also, one can introduce the carbon dioxide and can make salicylic acid. Salicylic acid is an important precursor for the synthesis of this aspirin. Aspirin is no more than your non-steroidal anti-inflammatory drug, called as NSAIDs, and that is responsible for inhibition of cyclooxygenase enzyme involved and controlled of various kinds of prostaglandins, prostaglandin A2, B2, D2. So there are so many prostaglandins. In other words, they are also called as prostanoids. Right. So cyclooxygenase inhibitor, just like we had similar another enzyme is called LOX, lipoxygenase enzyme. Okay, so this aspirin is used as a showing this kind of antipyretic or anti-inflammatory or that is also showing this another action is there which is recently has been discovered, and because of this it is used in blood thinning. So because it can cause the thinning of the blood, the जिसको बोलते हैं लोही पतला हो सकता है, because thickening of the blood can cause several disorders. Recently in COVID-19 pandemic, the patients are also being screened for, let us say, D-dimer assay, and that is that indicates the thickening of blood. And to D-dimer, we can provide it can provide us this estimation of thickening of a blood, and doctors are prescribing majorly this drug called glucose something. I forgot the name, but naturally it contains leucosprin. Leucosprin is the name of that, and that is nothing but the aspirin. So how the way this aspirin is over-acetyl salicylic acid, and structure is much similar as this one, and in the presence of esterase enzyme it will be metabolized to salicylic acid and aspirin. So your blockbuster aspirin is also a prodrug. Even if you look at the paramin of this paracetamol, that is also somehow kind of prodrug, where we are making an acetylation of paraminophenol to make this parahydroxyacetylide, right? ECM, which is a major API or ingredient behind Dolo 650 or there are other PCM, Paracet 500 mg. Right, so these are also prodrugs. They are nothing but the acids. Okay, but here the salicylic acid, why we are making its prodrug? Reason behind is it can cause gastric bleeding because of the presence of phenolic OH. Phenolic OH is basically kind of phenolic substances, or especially salicylic acid is there, so it is acidic in nature. But if phenol is there, so there is weakly acidic. तो ऑलरेडी कार्बोक्सिलिक एसिड था और फिनॉल की वजह से वो और ज्यादा एसिडिक है, so that's why it has a potential to cause therapeutic this. Okay, so this can overcome if we somehow by try to mask this phenolic OH, then one can easily hydrolyze this free drug to esterase, and thus it will be more useful for us to make the prodrugs. Right, so this is the approach that can be used for the purpose of making a prodrug for increasing the side effects and toxicity. So these are the approaches we have seen. The approaches we have seen to reduce the side effect and toxicity, to increase the drug activity, also to increase the membrane permeability, and though some of the approaches we have seen with the users of the prodrugs. Right, so with this we will be stopping this session for right now, and we'll continue our discussion in coming session. Thank you all.